Many teachers and parents and scientists have been advocating for better control in schools that is in line with current evidence. So, for example, the Center for Disease Control and the World Health Organization both recommend the use of masks in schools, particularly in secondary schools, but also in primary schools when transmission levels are high. We are also trying to encourage use of devices that help with ventilation, so air filtration and air purifying devices that can really reduce the risk of transmission. For example, if windows can't be kept open because it's too cold. And these devices should ideally be used alongside carbon dioxide monitors, which can help us determine and figure out whether the levels of ventilation we have in our classroom are sufficient. These are not very expensive, but do require a level of investment from the government. Mostly, we need to recognize that this is a respiratory virus that is spread through what we call aerosol transmission. What we mean by aerosol transmission is that the virus transmits or is spread the way, for example, cigarette smoke spreads in a room. So if you imagine that you're in a room with somebody smoking a cigarette, you can likely smell the cigarette or inhale the smoke, even if you're quite far away from the person, if you're indoors in a room. That's how the virus spreads. So just being 2 meters away from somebody who has the infection doesn't necessarily protect you from infection. Current school guidance considers contacts of people infected only as people who are in contact with the child for long durations of time within 1 to 2 meters. But the truth is that infection can happen beyond this, particularly in indoor environments, and we need to recognize this. So if someone is infected in a classroom, it's very important that everybody in that classroom bubble isolates, because it's quite possible that others may be infected as well. These measures are very important to prevent transmission within schools and from schools into communities, because many people live with children, particularly elderly people, including grandparents, who may be quite vulnerable to severe disease if they get infected.